the first figure is our current case counts, and you'll see on the far right-hand side, obviously Delta, we spiked up, but different than the rest of the state. Instead of spiking up really high, we went up and then plateaued, and we've just kind of been bouncing along on this plateau for now for a month now. We are starting to see cases come down. We were bouncing along about 30, 34 cases a day, and we're down 20 or less per day, which, I mean, a year ago, that would have been just unheard of to have 20 cases per day, but it's a new dynamic now. Hope to see that come down as we get into about the 12th week of this. I had projected about a 12-week cycle for this. We'll see if that comes to be. Otherwise, I'll have to change my hypothesis based on new data.
Okay, Dave, now flash back to a year and a half ago when we were waiting to get our 20th case period.
Right. Yeah, I used to call with every single case, call the commissioners, so wow, such a different world we're in now. Okay, so the next one down is our hospitalization counts. And you see we kind of spike and up and down. Where that becomes important for us is the availability of beds. So availability of beds is kind of the limiting factor on what we can do besides COVID, on optional things, surgeries, et cetera, that's part of the hospital's general everyday business that they're in. And with beds full with COVID now, not that full with Mason County, but the beds around us are full. So should we exceed our capacity here in Mason County, we don't have any place to ship people to because everybody's kind of in the same situation we're in. Our hospitalization counts are starting to come down now. I was just looking at them minutes ago. We have more beds available now than we've have had for the past couple of weeks. So that's a positive trend. Next chart down is cases by age group, and excuse me, percent vaccinated by age group. I didn't do cases per age group this time. So you'll see that our oldest Mason County residents are our most vaccinated group, and just kind of goes downward as you go to the left from there. It's interesting to see that if you compare this with our current age groups who are infected, our highest infection rates, in fact, our highest hospitalization rates are the 39 to say 50-year-old group, followed by the 20 to 39 group. So it's our lower vaccinated folks that are in the hospital and seeing more cases or more infections. And then on the next page, I just picked one group, the 45 to 65 or 64 group, to just give a graphic representation of people who are in a hospital who are vaccinated versus those who are not vaccinated. So on that chart, you've got the three colors. At the bottom, you've got green. Those are the folks that are in the hospital who are vaccinated. This is statewide data on this one, folks. This is not in Mason County, but this is a state data. The next one up in the blue are those folks who have had one dose of the vaccine so they're only partially vaccinated. And then the red are the unvaccinated. So what we're seeing locally, and I talked to Dr. Gushie about this at Area Command on Monday, is that, more than 90% of our cases in the hospital, and I think he said all of our deaths recently have been unvaccinated. So we're definitely seeing a protection factor from the vaccine as far as not going into the hospital and avoiding death. So I thought that was important. I didn't put a lot of detail with those. It's kind of a snapshot of what we look at every Monday and Thursday at Area Command. So any questions on what's happening right now, COVID-wise, data-wise?
None from me.
Okay. Okay, so let's talk about.
Dave, can I ask a question? Because I've been asked this question in a number of different ways, and I just was wondering for you on the state level if you have any information on this, but is there going to be any measure of people that have had COVID and what that impact is for either the health of the community or, how that measures out with,
Actually, I just got state modeling report 39, and I can condense that and send it out. One of the things it does show is the amount of immunity, so total immunity based on those vaccinated and based on those who have had COVID and recovered. So putting the two things together, giving you a total community immunity, and I can get that out to the board.
That'd be great.
I would like that information if possible.
Okay, I put it in, yeah, I've got a whole presentation. I'll send that out. I'll just send you what I sent to Area Command on Monday, and it covers a lot of that.
Okay.
So, and not only about the immunity, but our projections going forward from here based on the immunity, and maybe I should talk about that for just a minute. So DOH has done they're forecasting in two ways. One is a modest increase and one is a moderate impact. So the modest impact would show us coming off the backside of Delta with a fairly steep drop and getting below an R naught or an infection rate of less than 1. So an R naught of 1 for each person that has COVID, they will infect another person. And the more you go above that, the more exponential it gets. So if you get to 2, an R naught of 2, each person infects another 2. That's a bad thing to be. Right now, we're bouncing back and forth across the 1 mark. So DOH said, well, we'll do 2 scenarios. One of a modest one that, like I said, would drop us down fairly sharply on the backside of this going into November, and then slowly inching up as we go into flu season and other things as we get into December, like we did last year. The moderate increase takes into account being above the R naught of 1, so like 1.4, 1.5, and projects what that would look like. And I will have that in that for you as well. There's a couple of really good graphic presentations on what those would look like, both for cases and for hospitalizations. So we're starting to get some good stuff out of DOH on that piece. One thing we are lacking, though, that we have tracked in the past is the ability to look at the difference between the number of tests and the positivity rate, because they're about 700,000 test results behind putting them into the system. They get the positives out right away, but the negatives they're not putting into the system fast enough to keep up with our demand for data. So the data does not look right, and they've pulled it off of the DOH website. So we don't have access to that right now.
And that also doesn't include the home tests, probably.
No, it doesn't include the home tests. So what we've asked people to do, if they if they have a positive test on the home, is to go get confirmatory with a PCR at either the hospital or at the hub there in Belfair. And that way it does get it into the system. And that way we do get a lab, and the lab will automatically come into the system, where a home kit, if they were just to call us, we would enter that stuff by hand.
Right. Okay.